Dr. Mishal Reja, welcome to ITV Gold. I hope you're doing well today.
I'm doing great. Thank you so much for having me.
Of course, we have to have you because there's so much happening in the nation, especially when you look at coronavirus. So let's dig right into it, Dr. Reja. My first question to you has to be looking at some numbers and something that's coming up today as of now. As of now, in the United States, we're at 30 million cases almost and at least 543,000 deaths. Today in New York City, Mayor Bill de Blasio said that New York City's workers will be finally going back to work on May 3rd, and that will be in person. So my first question to you is, when you look at these numbers and how large these numbers are, is it wise to now announce that we'll be opening up more in May?
You're absolutely right with those statistics, and that question is great because it raises concern for a bigger picture that's going on. So I think what Mayor de Blasio is referring to when he talks about opening up these restrictions is cases are down overall. So since the peak in January, right now cases are down about 70%. Hospitalizations in the past month are down about 30%, and deaths overall are down. However, I think the reason your question is so important is because what we've been seeing nationwide, and especially in New York City, is that cases have actually been plateauing or going up. So we've eased lots of restrictions in the city. Right now, we have 50% capacity in restaurants, schools are opening, different shops are opening, and we're seeing this drastic uptick in cases, and we're seeing it in New Jersey too. So some of these efforts to increase openings, to get people back to work, we as physicians see the value in that, but it is a little too rushed. The city, Mayor de Blasio just recently issued a statement saying he's going to slow down or be more cautious about some of the reopening.
Right. And when you are looking at these numbers, Doctor, today CDC Director Dr. Walensky said that she is warning states that are in the Northeast and the upper Midwest, just like you just said, the cases are increasing. Who are the biggest contributor to these cases? And would you say the young population from age 20 to 40 are truly contributing to this?
That's such a good question. I think what CDC Director Walensky also said in that statement is that we're standing in a fork, and we can go down one road and we can go down another road. And right now, if we keep going down the road that we're going to get another fourth surge. So it's unclear about which demographic and which age group is contributing the most. But I will say that states like New York City, or cities like New York City, and especially Miami and Michigan, are contributing to the rising surge. So in Miami, we saw that they imposed an 8 p.m. spring break curfew because young people more and more are traveling, and they're bringing the disease there, they're giving it to each other, and they're bringing it back home. With that said, variants and easing of restrictions are typically contributing to the large increase, and a lot of young people are at fault for bringing those variants back home.
So what would you say to these states, Dr. Reja, that are currently loosening up, restrictions such as Texas, Mississippi, and many of the states are following? What do you say to them?
Too fast. I think that we live in the United States of America, and we have a separation of federal government, the CDC, the city government, and the state government. And while that has enormous benefits, what you see is some states are easing mask mandates, where it's so clear that the president of the United States, the top doc in chief, Dr. Fauci, the CDC director, are saying, please stop. And it's just establishing a dangerous precedent. Look, aside from being a doctor, aside from treating patients with COVID, aside from doing the rigorous training that all of us physicians had to do, I'm a son to my mom and dad. We're originally from Queens. Our businesses are in Jackson Heights. This just personally affects me. And I, just like you, don't want to see another fourth surge. We don't want to go back to it. I have so many stories, along with every other physician, of the deaths they've seen, the families who've lost loved ones, and nobody wants to go back to that.
Right. When you are looking at all of this, Doctor, European nations are going on strict lockdown. Germany just announced it. The UK has been on it. Do you see a lockdown happening in this nation if the cases keep on going up?
That's a great question. I do not personally see another lockdown happening. The reason that I don't see another lockdown happening is because right now we're at a race against time.
Right.
So what that means is we are one of the nations that are rapidly vaccinating people. So we have a 1 in 5 vaccination people in the country who've received a vaccine dose, which is amazing. So if we can speed up the vaccination process, we can actually get ahead of the variants that's causing this drastic rise in cases. Now, European countries are a little different because their restrictions were different, their vaccinations were different, and the rates of which they were vaccinating people were different. So as long as in the United States, we can get ahead of the variants, we can vaccinate as many people as quickly as possible, we're not going to see another lockdown like we've seen. But what we will probably see is an easing of restrictions. Is a stronger, slower restriction rollout.
Yes, hopefully what you were saying is true because we really want to get out of this. Just talking on vaccines, doctor, I have some questions here. Today, the US Safety Board expressed concern over AstraZeneca, saying some of the information that they're sharing is outdated. Now, AstraZeneca also faced some issues where some nations have banned it because of this issue of blood clots. However, the World Health Organization has said to continue using it. How are you looking at all of this? Is there a chance it will get approved in the US?
The FDA currently is undergoing a rigorous process with the AstraZeneca vaccine, and the way you posed that question was perfect because what I think it characterizes is there's a lot of confusion right now with the AstraZeneca vaccine. And I completely understand the public being utterly confused and looking at it and saying, I'm not going to take it. I'm not going to worry about it. There was the blood clots first. Now there's this confusion about the data. What's going on? So I think that the easiest way to make sense of it is under a rigorous review process, they did not find that there was a significant risk of blood clots. Sure, it happened with a small percentage of patients, but that wasn't something to be worried about with the vaccine. Now, with the old data, Dr. Jha from the Brown School of Medicine specifically said that he characterized it as this is a great vaccine with a really bad public relations rollout. And what that means is they weren't able to properly look at the data in a very stringent way. But until it gets to the FDA in the United States, we can rest assured that the FDA will look at all the evidence extremely rigorously before they even roll out this AstraZeneca vaccine. So if they roll it out, it's completely safe. We can trust the process. We have one of the most stringent review processes in the world. But I do think that right now we're at a good position where we have the Johnson & Johnson, we have the Pfizer, we have the Moderna. So if the AstraZeneca even comes out, that's not something that we need in this country exactly because we're going to have more than enough doses for a lot of people, especially with our rollout. But it is something that we can look ahead towards.
Yeah. Talking about trust, doctor, another vaccine, again, you just mentioned Johnson & Johnson single dose has been being administered across the nation right now. However, due to its efficacy, people are concerned about it. I know you can't choose the vaccine you're given, but how do you raise that awareness about Johnson & Johnson efficacy and safety?
It's a great vaccine. So I want to speak directly to your viewers and tell you that right now, if you're given the opportunity to get any vaccine, whether it's Pfizer, whether it's Moderna, whether it's Johnson & Johnson, take it. And the reason I say that is because the purpose of the vaccine is to reduce deaths and severe hospitalizations. So in that context, it is a wonderful vaccine because it will prevent you from dying almost perfectly. It will prevent you from getting extremely sick and ending up in the hospital. So if you're given the opportunity for the Johnson & Johnson vaccine, the Pfizer vaccine, the Moderna vaccine, they're all wonderful vaccines. And just back to your last question with the AstraZeneca vaccine, it's the same thing. If it comes into the United States, it's a great vaccine to take. The reason being, the data shows that it's 79% likely to prevent COVID-19, but it's 100% likely to prevent hospitalizations and deaths. And that's what we're concerned about. That's what a good vaccine does. So take the vaccine that's given because they're all wonderful.
Yes, we cannot stress the importance of getting these vaccines. We have to get to that herd immunity, that 70% of people, so that we can, go ahead and move on with our life. Another news coming in, doctor, today was Regeneron said that its monoclonal antibody cocktail reduces risk of hospitalization and death from COVID-19 in high-risk patients. What are your comments on these therapies and the evolvement you've seen so far in it?
The Regeneron monoclonal antibodies is one of the best kept secrets that we have in the United States. And the reason I say that is because while these monoclonal antibodies were actually released and given emergency use authorization by the FDA, they actually weren't used that much. So people that were in the high risk category that had COVID-19 could have gotten it on an outpatient basis. And as we've seen from this data, not have had to go to the hospital. So this data actually is not surprising for physicians because we've been following the Regeneron the data that comes from different phases. So we knew that these monoclonal antibodies were extremely effective. I personally know people that have gotten it. If I had a loved one that got COVID and in an outpatient basis, I would have happily recommended that they got these monoclonal antibodies. So I think it's something that we need to be aware of. So just in case, and I'm speaking to your viewers directly, if there's somebody that you know that gets COVID-19 and they are at an elevated risk, then I would say talk to your doctor, talk to your primary care doctor and say, hey, these monoclonal antibodies are out there. How can I go and get them? Because they're actually not that well known. A lot of people don't know how to get access to it. And just to wrap this around in context, the Regeneron monoclonal antibody was the one Donald Trump got when he got sick.
Right. I was just about to ask you that, and you answered that. When you are looking at these vaccines and these treatments, doctor, I have to ask you, what is still missing in all of this? What can doctors still figure out?
That's a loaded question. There is so much out there to figure out. Right now, the treatment in the hospital, when I go and see COVID patients, they've not budged as much in the last few months. There is right now extensive research going on about what we can do and how these medications are working, but there's so many more therapeutics. So we need to look more at the monoclonal antibodies. We need to look more at antivirals. We need to look more at immunosuppressions. Right now, we're very good at using high-dose steroids. We need to look more into how exactly we can oxygenate patients that have decreased oxygenation. So when COVID first started, we were intubating pretty heavily, but then later on, that standard of care changed pretty drastically. So it's an evolving science. We are still very, very, very early on in the process. It's great to see that the NIH and the FDA and everybody's involved and tons of money are going into researching the science. Right. So there's so much more that we have to look forward to.
When you're looking at the current administration, doctor, the Biden administration, are you satisfied with the work they have done so far to curb this disease? And how do you compare it to the last administration?
That's a great question. That's a loaded question. I want to first say that there's a lot of good news these days. So Biden's goal of 100 million vaccines was actually 6 weeks early. Yeah. So it's, again, a race to vaccinate, and we want to get those shots in arms for as many people as possible. I will never personally understand the politicization of COVID-19. I don't understand why an inept administration stemming from insecurity with medical science decided to confront the public health measures that they did. It affected many, many people. I think there were many people that died that didn't need to die. I think that there were many people that lost family members that didn't need to lose family members. And I think that he divided the country. Some people believe in masks, some people don't. So the previous administration definitely had some deficiencies, which I wish did not exist.
Well, thank you for your response on that. I just have 3 more questions left here for you, doctor. The first question is, air travel has hit a record since, during the pandemic now. People are traveling everywhere. How are you looking at it? And are you concerned, because the variants are also spreading, how that will impact us?
So what the science says about air travel is that it's not the actual airplane itself but it's actually the destination to where they're going. So we saw the holiday surge for which, we saw 4,000 deaths a day. And that was because a lot of people were actually going to destinations and mingling with family members. So the CDC issued an advisory saying, please do not travel if you can help it. And the reason being is because increased traveling and mingling with people from other states actually encourages mutations, encourages variants, and increases the spread. This is not over. We have to be extremely careful, especially about things like travel. And my recommendation, the CDC's recommendation, and on behalf of the medical community, if you can help it, if you do not have to travel, now is not the time to travel.
Doctor, there's also another debate around schools and teachers, if teachers should be and educators should be vaccinated before they go into schools. However, schools across the country are opening. The CDC has said it's safe to open without the teachers getting vaccinated. They have even said that you only need perhaps only 3 feet of distance between students. How have you looked at this whole situation, and what's your advice to parents?
First of all, let me say to all parents, I can't imagine how hard it's been if you have little kids at home and all of a sudden they've had to stay at home and not go to school. It's been hard. It's affected every mom and dad's daily life. And the recommendations did just change from 6 feet to 3 feet, which I think is encouraging. I've looked at the data and it does show that it's extremely effective, that 3 feet is enough prevention. Mayor de Blasio right now is actually going to reissue a call to parents to come back to schools. And I think that's the right move. We do need to reopen schools. We can do it safely. Before, the issue with schools was that if people were spread out 6 feet, it was actually too much. And it slowed the process of reopening schools. So right now, I think 3 feet is going to make a big difference. So as long as we can reopen up schools, it's going to be, it's safe, it's effective. We can keep people 3 feet from each other. And I think it's a wonderful thing that's happening.
So let me follow up on that. So if parents are still deciding if they want to send their kids back to school, would you tell them to trust the system?
100%, yes. Any recommendation that the CDC issued, especially when it comes to the 3 feet for 6 feet and the vaccinations of teachers, is on point. It's undergone extremely rigorous reviews. I would say it's very safe to send your child back to school. I would encourage it because at that point, then your child gets to go back to school. They get to re-socialize. They get to relate to their friends. They get to pick up on their social life that they lost, which is integral to growing up and getting older and developing those life skills. And also for you get that time at home to focus on other things like work or whatever things that you've missed out on because you've had to take care of a child who you thought would have been in school that year.
Right. What an issue for parents and children all across the nation. My last question to you actually has to do with South Asians, Dr. Reja. You know, we are the community that has high rates of diabetes, cholesterol, blood pressure, liver diseases, lung diseases, and are high risk. What is your biggest advice for these high-risk patients? And also, have you seen a connection between our population and higher rates of COVID-19 cases?
I'm so happy you asked that question. South Asians, as we know, have one of the highest rates of diabetes, as you just said, and heart disease. And that makes us more vulnerable to death and dying from COVID-19. So we have to be extremely careful to take care of ourselves during this moment. Let's remember, COVID-19 is not over. So what I would highly suggest for every South Asian person watching that's in a high risk category, meaning over the age of 65 with excess weight, please make sure that you're taking care of yourself. Look up how you can adhere to something called the Mediterranean diet, which reduces red meats, which reduces high fats, which reduces trans fats and heavy cholesterols, and encourages more plants and polyunsaturated fats like olive oil. I would say make sure that you're seeing your primary care doctor to control your blood pressure, to control your cholesterol, and overall make sure that you're keeping the weight down. So that the CDC actually recommends 30 minutes of exercise every day for 5 days, so 150 minutes total per week. So that's tough to do, but that's something we've got to do, especially as the weather gets better. Put your mask on, take a walk with your family members, because the risk is if we are unhealthy and COVID gets to us, then we're much more likely to end up in the hospital. And let's remember, COVID is not over. So we have to stay on top of our health. And overall, it's going to help us with heart disease and strokes and all those other things and cancers in the future. So let's take care of ourselves with diet, with self-care. I encourage things like meditation, which reduces blood pressure. I encourage things like stay with your social circle and really converse and have that connection and try not to be alone as much. And other smaller things like turn off the media, because that increases our stress response, which actually lowers our immune system too. So as much as you can, watch the news as you need it, but then step away from it when you don't.
Well, as you said, COVID is not over yet, and we just hope for the best for the future. Thank you so much for your time on ITV Gold.
Absolutely. Thank you so much.